Good evening, everyone. Welcome to our Mums Mastery session on twin pregnancy, a very much needed workshop. We have all our mommies with twins. So, this is a much awaited and exciting workshop. Are you all ready for the session? Lovely to see so many of you all live with us today. Let's welcome Dr. Janvi with us. She's a Garbha Sanskar expert and a certified Ayurvedic doctor. And she's going to tell you all about twins and the joys and the challenges that you'll face. And she's here to help answer all your doubts, questions, bust some important myths that have been going around about twins. So let's get started. Welcome, Dr. Janvi. Please take over.
Yeah, thank you so much, Kiran. Yeah, hey, mommies, good evening. Great. Hope everyone had your evening snacks and ready with this excited session. And I know most of you were much awaited for this session. Yeah, heartily I welcome you all. And it would be great if you can turn on your videos as well. Yeah. So, first of all, I'd like to ask you, can anyone, like everyone can just raise your hands. All are the twin moms here? Okay. Yeah. So we'll start on the session. So I'll be sharing my screen. Yeah, Kiran, is my screen visible?
Not really. I can see you started sharing your screen, but it's not visible. Mommy, are you able to view the screen?
No.
Yeah. So I also can't see it.
Yeah, we
Okay.
can see that she has started screen sharing, but what exactly is
Yeah, correct.
Yeah.
We can't see the screen you have selected to share.
Okay. Now, yeah.
No. Yeah.
Yeah, now.
Yes, yes. Perfect.
Okay.
It's still loading. Yeah. Now we can see it.
Oh, okay, great. Yeah. So, hey, mommies, we'll start on with our session regarding twin
These are
pregnancy.
daddies. We have daddies here as well.
Oh, okay, great. Yeah, hi, welcome to the Twin Diaries as well. A big welcome to you all. I will start our session. Hope you got me. Kiran has given a big introduction. Myself, Dr. Janvi. I'm an Ayurveda doctor and a Garbha Sanskar expert. Yeah, so we'll start. First of all, like I'm just sharing here what all we'll be kind of covering in this session. First of all, like I'll be explaining what is the definition, classification of twin pregnancy, incidents towards the twinning, investigations, complications, antenatal care in twin pregnancy, mode of delivery, postpartum challenges, and regarding breastfeeding. Great. So yeah, so twin pregnancy. So it's not only twin pregnancy, it is one among the pregnancy which comes under the multiple pregnancy. So most common is twin among which, okay. So what is the multiple pregnancy? Development of more than one fetus in the uterus is called multiple pregnancy. So during like in a pregnancy itself is a great enjoyable thing, and it's a lovable thing for each every parents, right? And everyone would be waiting for their like when the mom and dad they got to know they're pregnant, like they'll be having that much excitement. And once they got to know that twins, first of all they would be happy, and again they would be nervous, and lots of questions comes into your mind how to manage your pregnancy. Yeah, so not only twins, there are other pregnancies as well, multiple pregnancy, among of which there is if the embryo there is developing of two embryos or two fetus in the womb, it is called as twin pregnancy. If there is development of three fetus in the womb, it is called as triplets. And if there is development of four fetus, it is called as quadruplets, and much more. Okay, that is what how the multiple pregnancy goes. And the definition, like if the embryo is developing, and if there is two embryos is growing in one uterus or one womb in a single mom, then it is considered as twin pregnancy. And the next thing is classification. So when it comes to twin pregnancy, then the first thing you get into mind, like people will ask you, so is it a identical twins or a fraternal twins, right? Or a monozygotic or dizygotic? So have you ever, anyone has heard this terms, I guess, right? Like if you're already in your fourth or fifth month, obviously you would have heard this term regarding monozygotic or dizygotic. So how does the monozygotic twins develop? So if the single sperm is fertilizing a single ovum, then it is considered as monozygotic twin. Okay, and it is also a identical twins. So if you would have seen, so even though the twins will be there, but some of the twins would be identical to C and few will be non-identical, right? So if one ovum is being fused by one sperm, it is called as monozygotic twins. And the next one is dizygotic twins. So this dizygotic twins, how is it result? It's resulting from fertilization of two ova. So in a mom, so the two eggs are being produced and one single sperm would be fertilizing these two ova. And this leads to a dizygotic twins. It is also a fraternal and bino-ovular. And so this dizygotic twins can only lead to a dichronic and diamniotic twins. So like I'll explain you what is dizygotic and dichronic. First of all, like it's just a pictorial and a pictorial representation. How does a monozygotic and dizygotic twins will be presented? So the sperm, as I told you, one sperm would be fused with the egg and that forms a zygote. And here, usually in a singleton pregnancy, what happens? One zygote is formed. And this one zygote will be leading into a one baby, and that leads to a singleton pregnancy. Here, the sperm would be fused with the egg, and this leads to a division, and this leads to a zygotic formation, and two zygotes is formed, and that leads to two babies. That is what a identical pregnancy here it happens. And then the fraternal. So there comes two sperms, and two sperms is coming and fusing with the two ovum, and that is completely at two babies, two different babies, but in a single womb. Okay, there in this picture only you can see one sperm and other sperm is getting fused with one each single ovum, and it has been formed into a zygote, and that leads to a single babies. Okay, that is what the twin pregnancy. And the next is classification of these twin pregnancy. So you would have, like, as I got many questions as well, in that many have mentioned like the mode of delivery, and they don't know, like you have mentioned, few of them has mentioned, you know about the type of your twin pregnancy, and few of them doesn't know. So here I'm explaining you how does the type of pregnancy will be. So if the division, so first it's a an egg and a sperm get fused, right? And then a embryo is formed. That is where the fertilization happens. And this division, okay, division of the zygote will form within for hours after fertilization. Then it results in an embryo which will have two separate placenta and two amniotic sac. That is called as dichorionic and diamniotic twins. So it is happening at the immediate process, and they will be developing it two different placenta and two different amniotic. So most of you would be very much familiar with the word placenta. So here it is mentioned in a chorionic. This chorionic is not nothing but a placenta here. So if the division of the zygote happens within after hours of the fertilization, then it leads into dichorionic and diamniotic twins, and most of the population will be in the dichorionic and diamniotic twins. And the next thing is division takes place between 4th and 8th day after the formation of inner cell mass. That is nothing but the zygote, when already the chorion has been developed. Okay, like between 4th and 8th day post the conceive. Okay, post the egg and sperm is conceived, fused, and after 4 to 8 days, the division of the embryo is happened. Then it leads into the monochorionic diamniotic, because already the chorion means the placenta is developed, but the inner membrane of the chorion is what a amniotic sac is. So that leads into two amniotic sac is developed, but already the chorion, that means the placenta is formed, that leads to monochorionic diamniotic twins. And the next thing is, if the division after 8th day after fertilization, where the amniotic cavity is also already been formed, then it leads to monoamniotic and monochorionic twins, which is a bit dangerous, and we see it rarely. So only hardly 10% of pregnancy will be having a monoamniotic and monochorionic twins. So there are three classifications of twins. One is dichorionic, diamniotic. The other one is monoamniotic, monochorionic and diamniotic twins. And the next is monochorionic and monoamniotic twins. So understood everyone? Can you please give me a thumbs up? Yeah, great, perfect. So the next thing is, like, it is a pictorial representation, as I explained now, where the fertilization takes place and then the embryo is formed, zygote is formed, and this is where I told no, the chorion is already developed. Okay, and that this happens within a hour, and where the chorion is divided into two. So they have two placenta, they have two amniotic sac, and that leads to dichorionic and diamniotic twins. So here the zygote, where the morula is the embryonic cells. Okay, that is been already the chorion, means the two placenta is already formed, and also the two amniotic fluid is also formed, and that leads to dichorionic and diamniotic. One more thing, so here the monozygotic and dizygotic. So dizygotic always leads to dichorionic and diamniotic pregnancy, but a monozygotic can be dichorionic diamniotic, it can be monochorionic diamniotic, and it can also be monochorionic and monoamniotic. Okay, so these three things can be a possibility, but if the dizygote can always leads to dichorionic and diamniotic, and it would be a fraternal twin pregnancy. And if it is a monozygotic twins, then it can be also dichorionic diamniotic, and it can also be monochorionic, monoamniotic, and monochorionic and diamniotic as well. So two placentas are there, two amniotic fluids are there, sacs are there in diamniotic and dichorionic. And similarly, in monochorionic, we have only one placenta which is nurturing both the babies, but they have their own amniotic sac. But again, in monochorionic, monoamniotic, what happens? Here we have only one placenta, and both the babies also sharing only one amniotic sac. Let's see, here only you can just see the picture and you can understand why this monochorionic and monoamniotic is a bit dangerous, because both the babies share a single placenta and both the babies sharing a single amniotic fluid sac. Okay, yeah. And the next thing is incident. So this is the introduction is fine and definition, and you understood the classification. So we want to know, right, randomly how, where, and all this twin pregnancy is common. So it varies widely. So in Nigeria, in being 1 in 20 pregnancy, there is a widest population of twin pregnancy, and it is lowest in being 1 in 200 in Eastern countries. Okay, so that is where the incidence, and monozygotic twins, as I told, it's rare. So monozygotic twins are 1 in 250 in the world. The next, the factors. So you will always you get a doubt when you got to know that you are a mother for a twin pregnancy, right? So the reasons or the factors which influence the twinning. Here is a race. As I told in the last slide itself, there are in Negroes, especially the race, when it comes to race, Negroes are the one having highest of the twin pregnancy and lowest among Mongolians and intermediate around Caucasians. And next, the hereditary. So if you already has a family history, especially in mother, if you have a family history of twin pregnancy, it can be a chances of hereditary factor as well. And then the maternal age and parity. So if the age of the mother is more than 30 or 35, after that, and also the parity means the, like, if you have already have a 3 to 4 kids, and again if you are pregnant, then it can lead to a twin pregnancy. That is what the parity we can say. Okay, and also age and parity will also matter here for the factors of twin. And next, the nutritional factor. If a mom or if a expecting mom is taller and heavier, so if she is taller than more than 6 feet, okay, and then also the twinning rate is on higher side. Okay, and also the pituitary gonadotropin. So if this hormone is highly secreted in the body, and then it leads to a twinning. And then infertility therapy. So this most of you would be knowing, right? So there will be lots of moms who has been got conceived with the IVF pregnancy. So can you just thumbs up if your pregnancy is a IVF pregnancy? Yeah, I don't see no thumbs ups here.
Yes, I think only Tejal said a thumbs up. Very few out here.
Okay, it's great. Yeah, so most of the twin pregnancy mom would be bit also of IVF, but here it's really great. Yeah, so IVF pregnancy, because there will be a transfer of 2 embryos. Okay, so here multiple embryos would be transferred into the uterus for the better amount of a conception. That is why it can lead to a twin pregnancy. And also artificial reproductive techniques. That is also similar with the IVF, and it is also artificial thing which they are doing, and the embryos will be introduced into the uterus based on the parity. Okay, so that is why this multiple pregnancy can also happen, especially twin pregnancy can happen in IVF and artificial reproductive techniques. Yeah, and the next thing is investigations. So first you got conceived, and then what the first thing you do, like before you get to know that you are conceived. So usually you will go for a blood test. Like first you would be going for a UPT, and there you would be able to understand much. You just get to know that you are pregnant, right? And then you will go for a test for beta HCG test. So how you can also get to know that you are a twin pregnancy if the levels of beta HCG levels is on higher side, and also the elevated maternal serum alpha fetoprotein levels. Okay, if the alpha fetoprotein levels is also on higher side, then also we can hardly detect that you would be having a twin pregnancy. And also the unconjugated estrone means the unconjugated levels of estrogen. So in the serum blood test, if we get tested, even there we can understand there are chances of twin pregnancy. Okay, so this is with respect to biochemical tests. And then we have sonography tests. So most of you, like, you will be got like you would already got done with your scans, right? The early scan would be done between 6th to 8th week of pregnancy. So that scan is also called as early scan, and also this scan is done to check for the fetal heart rate, fetal pole, and also the chorionicity. Okay, especially to detect the placenta and also to detect whether it is a dual twin pregnancy or singleton pregnancy, right? So this sonography or USG is done between 6th to 10th week of pregnancy. And in this scan itself, you'll be able to understand whether there is separate gestational sac. So in this scan, if you get to see, like the gynecologist or the radiologist while doing the scan, they will be able to see two gestational sacs. Okay, and they can also able to detect the two different fetal heart rates. Okay, that is where the first scan you will be able to get to know that there are twin pregnancy, and only that would be able to understand. Much more knowledge will not be obtained in that scan. Okay, and then after that, the diagnosis as between 10th to 12th week of pregnancy. It can be NT scan, but if you get to know that there are two gestational sacs, again, the gynec may advise you to get one more scan in between 10th to 11th. Or else if the fetal heart rate is also detected, especially multiple fetal heart rate is detected in 6th week scan, and again, for the confirmation, they will be asking you to get the 10th week scan. Okay, there also they'll be able to understand the sac. Okay, they can be able to see the gestational sac, and they also can be able to detect a chorionicity, means the placenta. Okay, there itself they'll be able to see the chorionicity. And now I told you regarding the three classifications, that is that is dichorionic and diamniotic, monochorionic and monoamniotic. So you will have to get to know, right? Because these three things has its different growth and development, its different risk, right? So to detect and to understand whether it is which type of twin pregnancy, this scans is very much important. So there is there is one important sign called twin peak sign. If the pregnancy is a diamniotic and dichorionic pregnancy, then in that scan, okay, in the scan they'll be able to see that there is a twin peak sign. So in the uterus where the fetus is been getting developed, there we can see a sign. Okay, it will be in a sign of lambda. That means it shows there is two placenta. Okay, so in your scan, if you are like if you have a dizygote, diamniotic and dichorionic pregnancy, you can just check your scan reports as well. Going back after this session, you can just see something called like a lambda sign. So that is what a twin peak sign. So if that sign is detected in your 10th week of pregnancy scan, then it is confirmed that it is your diamniotic and dichorionic pregnancy. Instead, if this sign is absent, it is called as T sign. Okay, if this sign is absent, then the gynecologist get to know that it could be a monochorionic, monoamniotic, or it could be a monochorionic and diamniotic diamniotic twins. And that also they won't get clear picture in that scan itself whether there is a membrane between two babies or not. Okay, where the membrane is nothing but the two different placenta or two different amniotic.
You can continue, doctor.
Yeah, okay. So like if there is any intermediate membrane is there or not, they'll be able to check only after your second trimester. Okay, so until then they'll be like they understand, but they can confirm it only in your anomaly scan. Okay, so after your first early scan, there will be next scan called as a NT scan. So that is it between your 11th to 13th week of pregnancy. Hope many of you have got done with the scan. There again, they'll be able to understand the crown run length. Okay, that generally with respect to normal pregnancy, there will be crown run length. There will be like the umbilical presence of the placenta, right? Whether it is just covering the internal os or else whether it is more away from the internal os. Okay, so these things will be able to understand in this NT scan, and also mainly congenital anomalies. So if this placental thickness is too much, then there can be a chances of congenital anomalies like Down syndrome or Turner syndrome. So this thing also would be able to understand much better in this NT scan. Okay, and next these are the first pregnancy, like first trimester scans, and next you'll be going for a second trimester, that is your anomaly scan. Okay, so after I got to know that is a monochorionic and monoamniotic. Okay, so first we'll be dealing with each and every type. So if it is a monochorionic and monoamniotic twins, then what I have to do after 16th week itself, will the gynecologist will ask you to go for a repeated scans, because as I told, they both the babies are sharing a single placenta and single amniotic sac. We can ask what is the difference and what is the issue if both the babies are sharing a single placenta. Okay, so through a mother, the baby is getting nurtured and nourished, right? So from the mother, there will be an umbilical cord developed, and through that umbilical cord, the baby would be getting nourished through the placenta, right? So this placenta again has to nourish the baby. So while nourishing, there are many vascular anastomosis. Okay, if there is any variation, as there is single placenta, they don't know, right? Whether the one baby would be getting too much of nourishment and the other baby would not be getting nourished well. So to understand this, any complications with the vascular placental anastomosis, then a complete and more frequent visits is very much necessary here in respect to monochorionic and monoamniotic pregnancy. And if they get to know it is diamniotic and dichorionic, then it's similarly with respect to singleton pregnancy, because both the babies has their own placental membrane and also has their own amniotic sac, and the nourishment would be happening equally, or sometimes a little bit on higher side, a little bit on lower side. That is something, nothing to be worried here much. And then again, we have monochorionic and diamniotic. Here also, it's more or the same. It's just similar to the monochorionic and monoamniotic twin pregnancy. So even here, the much of care and necessary of repetitive scans is very much necessary. Okay, and next the pregnancy dating. So that is what with respect to the estimated delivery date. Okay, they'll be able to understand the estimated delivery date based on the baby's growth and development. That is also done in your NT scan itself. And next, the fetal anomalies. So fetal anomalies is also done in NT scan with respect to the congenital anomalies. So fetal anomalies is nothing but congenital anomalies. Next thing is fetal growth monitoring and presentation and life of fetuses. So this would be done with your sonography of your anomaly scan. Okay, so 5th month scan, generally this I'm telling with respect to diamniotic and dichorionic pregnancy. Here, then you will be going for your anomaly scan between 18th to 22nd week, but as it is a twin pregnancy, you will be going in your 18th week itself, and then they'll get to each and every, like both the baby's growth and development, the weight of the baby. So according to this 5th month, the baby would be almost around 200 to 300 grams. Each baby would be having the similar weight, more or less. Okay, that would be monitored. And also they'll be able to see whether the pulsative index, PI value, whether both the umbilical arteries is being able to nourish the baby well, or else is there any complications. This thing also we'll be able to understand in this anomaly scan. Okay, and also presentation. At the first itself, the presentation of the baby is in breech position. However, the babies will be changing its position inside the womb, but still will be able to understand the presentation in this anomaly scan as well, and also life of fetuses. So whether both the babies are on overlapping, or else both of them are getting better nourishment, or what, everything also will be able to understand in this anomaly scan. And with respect to after this anomaly scan in this 5th month, then a fetal echocardiogram scan. Okay, this also being done in your 6th month between 24th to 27th week. This scan is done for 2D echo scan, will say. Okay, when this is advised in all the twin pregnancies, it is much more necessary in monochorionic and like monochorionic, monoamniotic, and also monochorionic and dichorionic but still it is advisable in both diamniotic and dichorionic scan as well to understand whether the growth and development of the baby's heart is fine or not. Because in monochorionic and monoamniotic, if the blood flow is not proper, then it can lead to a complications. Right? There is a twin-to-twin syndrome, that is one complication, and also the single intrauterine fetal growth retardation, that is also another complication. Okay, and there can be chances of echogenicity in the fetal heart. Okay, there is one more complication with respect to the babies in which is called as twin restricted arterial pressure. So here the fetal heart would not be developed. The second baby's heart would not be completely developed in case of a monochorionic and diamniotic or else monochorionic and monoamniotic pregnancy. These things would be able to understand. So sonography is very, very much important in twin pregnancy. And then the next scan will be done in between 28th to 32nd week. Usually 28th week itself, the growth scan is done to check the weight of the baby, positions of the baby, and also the continuous growth is to be monitored. Like in a singleton pregnancy, a scan in 3rd month, which is NT, like early scan in between 6th to 10th week, and NT scan, and then 5th month anomaly scan, and then 7th month scan, and next in the 36th week scan is enough if everything is fine. But here in twin pregnancy, the multiple scans is very much important to understand the growth and development of the babies. Okay, so if it is a diamniotic and dichorionic pregnancy, then a 28-week scan is enough to check for the growth and development of the baby. Again, in the 32nd week, along with the Doppler, how is the blood flow to the baby is going, that is done. And again, like if everything is fine and good, 36th week, they'll be going for one more scan, and then they'll be planning for the delivery. Or else they still see everything is fine. If there is no complication, then they'll be continuing with the pregnancy until you get a natural contractions or induction. That will be further decided. Okay, and next in the growth scan or in between the anomaly scan itself, in respect to the babies of monochorionic and also monochorionic and diamniotic, they will be understanding the twin-to-twin transfusion. Okay, and then increase in amniotic fluid. You would have heard the word or the term called polyhydramnios or oligohydramnios. So here there are a few complications called twin-to-twin that I'll explain further. Okay, that is with respect to the fetal complication. Okay, so now we'll reach to first discuss regarding the maternal complications. Maternal means mom. What are the complications of this twin pregnancy in a mother? Okay, so this is divided according to during pregnancy, during labor, and during puerperium. Is nothing but during the postpartum. Okay, so here what happens during pregnancy? Now, when compared to a singleton pregnancy, then a mom who is having this twin pregnancy, the nausea and vomiting issues would be on higher side. Okay, why? Because during this twin pregnancy, there are in the uterus has to distend a lot, the space need to be more, and there will be pressure of these two babies over your upper part of the body. That is why you will experience lots of nausea and vomiting until your 3rd month to 5th month. And sometimes throughout the pregnancy, you may experience this vomiting and nausea issues, which is also called as hyperemesis gravidaria. Okay, that is one complication. And next up, pregnancy related anemia. Why anemia? Because you have to nourish both the babies. So lots of hemoglobin is necessary in your body, and the plasma, like there is a term called hemodilution. So hemodilution, what happens? Whatever your RBC cells would be diluted in the plasma, and even that can lead to anemia. And mostly preeclampsia. So most of the moms would be having preeclampsia conditions. Most of the 20, like in and around 25% of twin moms would be having preeclampsia condition. So preeclampsia means increase in blood pressure, and also that can lead to a restricted growth of the babies. Okay, so the mother would be experiencing the hypertension. This can happen usually after 32nd week, but generally in twin pregnancy mother, it can happen in her fifth, like in the period of 5th month of pregnancy itself. Okay, next the hydramnios. So this is nothing but the increase or polyhydramnios. So increase in fluid of the fluid in the babies, so that can leads to a swelling in the mom. Okay, the mother could experience swelling in the body. That is called as hydramnios. And then antepartum hemorrhage. So there is a placenta and two babies are growing in the single womb, and there would be pressure of this placenta, these babies over the placenta, and that can lead to rupture of the placental membrane. That is called as antepartum hemorrhage, which can lead to rupture of placenta, and that can lead to bleeding or spottings. Okay, that is what called as antepartum hemorrhage. And then the malpresentation. So due to the baby's malpresentation, the babies can lead to the mom also will be experiencing difficulty in her pregnancy journey, especially in respect to the pressure over her lower part of the body, especially during over the bladder as well. Okay, that is one among the maternal complications during pregnancy. And next, the preterm labor. So most of you would have heard when it is twin pregnancy, most of the you would have heard and you would be very much scared because of the preterm labor, or you would be having a pregnancy fear that your baby would be delivered in your 6th month or 7th month, right? So that can also happen, and it would be affecting the mom as well mentally, so that can, and also physically as well. So that is what the preterm labor can happen. And next thing is during labor. So when the mom is in the labor room, what can happen? Early rupture of membrane. So we have placenta, and if they're like after the delivery of the babies, placenta has to come out of the body. So early rupturing of membrane can lead to lots of loss of blood. Okay, that is sometimes kind of fatal thing for the mom as well. Okay, that is what one of the complication. And cord prolapse. So during labor, the cord prolapse can happen, and that can lead to fetal of the baby and also mother as well. And next to the prolonged labor. So as there are two babies, if you are having a chance for natural vaginal delivery in respect to diamniotic and dichorionic pregnancy, where the labor can lead to prolonged labor, and also increased operative chance. So if the two babies, first baby is in cephalic position and the first baby is delivered and the second baby going into fetal distress, then it has to end up with the C-section, right? So like that, increased operative chances are there. Bleeding can happen, and postpartum hemorrhage. Like during pregnancy, if the placenta ruptures, then it leads to antepartum hemorrhage, and post-delivery, okay, or during labor, if the placenta gets ruptured, then it is called as postpartum hemorrhage. Okay, and during postpartum period, okay, subinvolution means there can be a chances of absorption of placenta in the body. So that is what called as subinvolution. And infection. So post delivery, it can be an infection because of like most of the like especially monochorionic, monoamniotic, and monochorionic, and the diamniotic mothers would be going into C-section. So there can be chances of infection, and there can be a chances of lactation failure as well. Okay. Yeah. So that is what the maternal complications, main maternal complications during the twin pregnancy. Along with these things, there can be chances of gestational diabetes mellitus, because if the levels of fluid increases in twin pregnancy, most commonly you will be having gestational diabetes mellitus. And also during pregnancy itself, there can be chances of placenta previa. Placenta previa is nothing but again similar to antepartum hemorrhage, where the placenta would be getting pressurized from the baby, and it would be closing the internal os. Okay, that is what called as placenta previa. And if this is a condition, even though the babies are dizygotic and dichorionic and diamniotic, then you have to go for C-section, because as I already told, the chances of like first the thing is to come is the placenta, right? So that is why placenta previa is also one among the complication, and also placental abruption. So because of the like too much of pressure over the placenta, there can be chances of rupturing of the placenta from the uterus lining. It is called as placenta abruption. So this happen, and then the baby would not be nourished well. So this is also one among the commonest complication, especially maternal complications during pregnancy. Now we'll go on to the fetal complications. So fetal complication main thing is preterm delivery. So it is the most common complication. It can occur if the delivery happens before 37th week, then it is considered as preterm delivery. Okay, so usually in normal singleton pregnancy, if everything is fine with the pregnant woman, and if she is not getting induced or if she is not getting a contractions, then the pregnancy can end up until 40th week. Okay, but in a like twin pregnancy, even though the monochorionic and monoamniotic, if that is a condition, then if there is no complication, the delivery has to be planned by 36th week. Yeah, that is what it is considered as preterm delivery is more common in the twin pregnancy, and it is one of the complication. Okay, and also, so as the parity means, if it is a twin pregnancy, then delivering by 36th week. If it is a triplets, then they're delivering by 32 weeks. Like if it is a quadruplets, then they have to deliver by 28th week, like that. So more the number of babies in the more the number of fetus, the early the delivery should happen to avoid further complications. Okay, and the next thing is IUGR. This you would have heard a lot, intrauterine growth retardation. Okay, why this happens? Because of the placental crawling. What happens with placental crawling means there are conditions like monochorionic and monoamniotic because they are sharing only single placenta, and this single placenta has to nourish both the babies, right? So at that time, sometimes one baby could get a good amount of nourishment and one baby may not be able to get better amount of nourishment because of this placental vascular anastomosis. Okay, that can lead to intrauterine growth retardation. And also the causes for intrauterine growth retardation can also be a preeclampsia as well. As I told you, if the mom has this preeclampsia condition, and also if there is pressure, okay, the uterine arteries would be nourishing the baby through the placenta, right? And if there is pressure in this uterine arteries, even then the placenta would not be able to nourish the fetus well. Okay, so that is why if the PI values is on higher side, then it will leads to IUGR. Yeah. So the next important, like I'm not sure if you have, most of you have heard these words, or but still you'll be having that dilemma in mind whether the babies are getting nourished and why my gynecologist is asking me to go for continuous or repetitive visits, right? So these are because of these kind of complications, especially the fetal complications. So as I told you few of the words during I explained the regarding sonography. Okay? So twin to twin transfusion syndrome. So this will happen only in a monozygotic twins, especially in monochorionic and monoamniotic, monochorionic and diamniotic. This could not happen in a dizygotic twins. Okay, so what happens in this twin to twin? There, the placenta, right? So one baby would be getting much nourishment through the placenta. So one baby will be having lots of fluid in it, that is polyhydramnios can happen, and also the nourishment of that baby would be on higher side. Okay, that is what twin to twin transfusion syndrome. So there are two babies, like as there are two babies. So here where the monochorionic monodiamniotic share one placenta, so they also share blood vessels along with the placenta, right? And this can be diagnosed with the scan. So as I told you, only in scan will be able to understand the fluid levels, right? In the growth scan or in anomaly scan in 5th month, even in that scan, we'll be able to understand if one baby is having too much of fluid surrounding it, and around one baby if the fluid is on lower side. So there comes a donor baby and a recipient baby. Okay, so the donor baby would be, yeah, here you can see. So in this pic, we can see the both have a normal monochorionic twins. So they both the babies are getting a normal nourishment and both are developing well normally. But here what happens, one baby is getting too much of amniotic surrounding it, and baby is in an accurate proper growth, but the other baby is in a small growth and development. Okay, so this can happen If it is like the babies itself, like the in between the babies only the umbilical cord are there, no? So the babies itself would be nourishing the other baby, and the one baby, like the donor baby, would be in a risk there. Okay, that is what twin to twin transfusion syndrome. It is one among the most commonest complications of a monochorionic pregnancy, or else the monochorionic and diamniotic pregnancy. Yeah, and the next here, yeah, you can just see here. So this unbalanced shunt flow means this is the placenta, and through the placenta, one baby is getting lots of nourishment, and there are increased amount of fluid is there. Here, the donor baby comes, and it can leads to a small baby. Yeah, and what are there are complications for both the babies here. The recipient is also having its own complications and problem. Donor baby also has its own problem and complication. So polycythemia, hypertension, polyuria, polyhydramnios, circulatory overload, heart failure, hydrops, and fetal demise is what the recipient baby can go through. Okay, so polycythemia means there is increase in condition of a blood cells. Okay, there will be increased amount of RBCs in this baby. And hypertension, as the baby is getting too much of blood flow, right? That can lead to hypertension. Polyuria. So what happens whenever the baby is nourishing well, the baby is producing enough amount of urine. That becomes as an amniotic fluid as well. That is called as polyuria. Okay, and also polyhydramnios, that is increase in amniotic fluid. And circulatory overload, it's again nothing but the vascular anastomosis, the too much of blood flow into that baby. And heart failure, as there is circulatory overload, right? The baby's heart doesn't have that much capacity to pump the blood throughout its heart, and that can lead to heart failure as well. And also fetal demise, that is where the baby, like once the circulatory overload happens and heart failure happens, then it can lead to a fetal demise as well. And what happens with the donor baby, as it is giving all the nourishment to the other baby, there can be anemia, and opposite to the same. Here there is a polycythemia, here is a anemia. And hypotension, oliguria, oligohydramnios, which is less amount of fluid, circulatory insufficiency, baby doesn't able to pass the blood throughout the body, growth restriction, renal failure means if the baby is not getting nourished well, and the baby's bladder would not develop well, and that can lead to renal failure, and there also fetal demise can happen. So this is what one of the main complication and the commonest complication seen in monochorionic twin pregnancy. Yeah, and the next complication is selective fetal growth restriction. Okay, where this happens if the placenta is shed unequally. So this complication does happen only in the monochorionic, monoamniotic, and also monochorionic and diamniotic, as I told you already. And also here what can happen, the growth restriction can happen. One baby here, most of you have mentioned, right? Like one baby will be getting too much of nourishment, and one baby will not be getting enough amount of nourishment. Why? Because the placenta is shed unequally. Okay, that is the reason. Once the umbilical cord has to get inserted well at the proper position, right? Then only the nourishment can happen equally. Okay, so if the cord is not inserted properly to the placenta, then it can lead to unequal nourishment, and that can lead to unequal growth of the babies. And the next thing is twin anemia polycythemia sequence. As I told you, as the single baby. So this also comes under kind of twin to twin transfusion syndrome. Okay, so the baby would be getting enough amount of blood supply, and then that leads to increased amount of RBC in this particular baby. Okay, these things are most reduced, like this doesn't happen most commonly. Okay, so need not to be worried much about this twin anemia polycythemia sequence. These are the main complications. One is twin anemia polycythemia sequence, twin to twin transfusion syndrome, selective fetal growth restriction, twin reverse arterial sequence. So here what happens, as I told you, like one baby would be, there are two babies, so one baby's heart can fail. Okay, the development would not happen well. Okay, so properly, and that can lead to a cardiac twin, and this baby would not be able to deliver, and that can lead to vanishing of one twin in the womb itself. Okay, these are the main of the few of the complications in the fetal. Yeah, and one more thing, most of you would have heard or seen as well. So there is the concept called vanishing twin. So this happens like in when you went for your first scan, and sometimes when you went for your NT scan also, you'll be able to see both the gestational sac and heartbeat has been developed in both the babies. But after next scan, then they will not be able to see one twin. You can like you will be getting to see that the demise of one fetus. Okay, this if it is detected in early scan, that is in your NT scan, then it's completely fine, and that would not be creating much complications to the surviving twin. Okay, and like post delivery, the baby would also be delivered and like through placenta because it's just in its early weeks, right? And if the demise of this baby after its 20 to 22nd week, then it is a serious condition. Then the surviving twin can also get affected with this, okay, with this demised baby. So you will have to be continuously under monitor with the hospital and also with the repetitive scans. So vanishing twin, it's most common, not in diamniotic dichronic, in monochorionic monoamniotic, again because of these reasons, twin to twin transfusion syndrome, or else unequal growth and supply of placenta, the one baby would be vanished. Okay, yeah, and the next thing is antenatal care. So hope everyone understood regarding the complications of twin pregnancy with respect to maternal and fraternal, got what is the TTTS, twin to twin syndrome, and fetal intrauterine fetal growth retardation. Yeah, fine. So next we'll move on to antenatal care. So mostly antenatal care in three types, right? Dichorionic diamniotic and monochorionic diamniotic, monochorionic monoamniotic. So how is the antenatal care? So first you will be going for a first prenatal visit, right? So in case of dichorionic diamniotic, it's similarly like a singleton pregnancy. First you'll be going like until your 7th month, you'll be going every 4 weeks. Okay, and then as I told you, the first scan in between 6th to 10th week, and the second scan is NT scan, and the third scan would be an anomaly scan. Until then, we'll be going every 4 weeks to doctor's visit. And then by 28th week, then every 2 weeks, the visit has to be went. Okay? So later, post 28 weeks, the baby's growth and development would happen well, and then they have to monitor you closely. Okay, so that is why post 28 weeks, every 2 weeks visit has to be done. And that after 36th week, every week you have to visit until the delivery. Okay, that is in case of dichorionic and diamniotic twin. And then in respect to monochorionic and diamniotic, first prenatal visit would be every 4 weeks and 16 weeks. At 16 week itself, you will start visiting every 2 weeks from your 4th month of pregnancy itself. Again, 36 week, again every week. Like if there is no complications here, monochorionic, diamniotic, there is no TTTS complication and there is no such complications with the baby, then this pattern of visit will be good. And if you have any other complications, after 16 week itself, once in 2 weeks, you will have to visit the gynecologist. Okay. And then with respect to monochorionic, monoamniotic, the first prenatal visit happens every 4 weeks, and after 16 weeks itself, every 2 weeks you'll have to visit. And here, if the monochorionic, monoamniotic babies, if you have this twin to twin syndrome, then sometimes it needs a admission at the hospital itself, like inpatient surveillance we call. So you'll have to get admitted in the hospital itself throughout your pregnancy. Okay, so post 16 weeks, there can be chances if there is any complication. There is a monochorionic monoamniotic associated with polyhydramnios and also associated with placenta previa, something like that condition. Then they advise you to visit the, like be in a hospital, or at least they will monitor and if they'll be giving you with a progesterone hormone to maintain the pregnancy, and also they'll be advising you to go for a cervical sucklage. Okay, most of you would have heard about this term, cervical sucklage. It's nothing but the stitching of the cervix to hold the babies inside the uterus. Okay, and usually while checking your cervix length after NT scan, and also next with the anomaly scan, they'll be monitoring your cervix length. After that itself, the gynecologist, if there is necessary, they would advise you to go for this procedure called cervical sucklage to maintain both the babies inside the uterus. This only depends upon the cervix length and also the based on the risk of pregnancy. Okay, especially in monochorionic monoamniotic, the delivery would also be advised at the early stages because there can be chances of cord entanglement. This is also one among the commonest complication in monochorionic and monoamniotic pregnancy. Okay, so the babies can get off their cord around their neck easily. That is why until 28th to 30th week, they will be monitoring closely. After that, they would be delivered at immediately in the 7th month. Okay, so antenatal care with respect to gynecologist visit has to be went like this. Yeah, and next with respect to the nutritional support. So yeah, I got to know that one question was there, like you are a twin mom, so you need to eat extra. So you should keep on eating. Yeah, so not unlike like singleton pregnancy, extra 300 calories should be taken in case of twin pregnancy mom. Because you have to nourish both the babies. Actually, like both the placenta has to get nourished to the two babies. So nutrition value is very much important, and also the supplements like iron supplements, calcium supplements is also needed in a double graph. If a normal singleton pregnancy mom is been taking 30 milligram, then you have to take with your 60 milligram until your delivery. Okay, 60 milligrams of the iron supplement and folic acid supplement, calcium supplements, and if it is a IVF pregnancy and based on the risk, they also advise you to take progesterone hormone. Sometimes it do in the form of injections as well, sometimes in the form of the tablets as well. Okay, to maintain your pregnancy journey. Okay, and along with that, the good amount of all the macronutrients and micronutrients, okay, vitamins, minerals, everything should be taken according to the proper quantity so that you are able to nourish your babies well. Yeah, and then with respect to the yoga and meditation, we like you all are IMOM's mommy, so you know much about the yoga and meditation, and you know how does it affect with respect to your mental health, right? So that also helps your baby's growth and development as well. The serotonin hormone will be secreted, and you'll be having lots of challenges mentally as well with respect to twin pregnancy. So to calm yourself, you will have to go for yoga and meditation. And most of you would have a doubt, right? Like, why should I not go for labor prep yoga? Why should I not go for Garbha yoga? So that's again based on this complications like placenta previas, placenta abruption, and also placenta accreta. So there can be chances if there is pressure, there is two. Like generally, our uterus has a capacity to grow one baby in our uterus, but as this is a twin pregnancy, there will be a much pressure over your uterus. That is why you will be advised to go with mild walking and normal household activities and with the meditation and yoga. Okay, and also, so to avoid postpartum challenges like mainly postpartum depression and postpartum blues, and you also have pregnancy blues, and also to avoid preeclampsia, you should incorporate yourself in yoga and meditation. Okay, and also you should open up to with your partners, okay, and you can have to have a good talk with your family members so that they can also support you, like emotional support, physical support, everything is very much necessary here in respect to twin pregnancy. Okay, that is where the antenatal care also comes into. Yeah, and the next thing is mode of delivery. I know most of you would be waiting for this content of this twin pregnancy, right? Mode of delivery. So first of all, there are few factors which influence the mode of delivery of twins, right? So now you heard a lot about the monochorionic, monoamniotic, dichorionic, diamniotic, and also monochorionic, diamniotic. So for this Momo twins, monochorionic and monoamniotic twins, we just have a mode to deliver the baby is a C-section. Okay, so as there is a single placenta and single amniotic fluid, and also both the babies would be lying. So other than C-section, like it's quite impossible to deliver the babies because there is a placenta as well, and there can be chances of postpartum, like during the delivery itself, the bleeding can happen, right? That is why to avoid that, and also to avoid any umbilical cord complication, there can be chances of cord entanglement, as already told, right? So that is why only in case of monochorionic, monoamniotic twins, and also sometimes in monochorionic and diamniotic twins also, C-section is advised. And then the position. Okay, even in singleton pregnancy, if the baby is in breech position, means if the baby's head is towards the upwards and legs is towards the down, means presenting part at the time of delivery through vagina is the baby's legs, then it's quite impossible to go for natural vaginal delivery. Okay, and based on the experience of obstetrician. So if the gynecologist is very much experienced in doing the twin delivery, then also they can try. And if he is confident enough, they can try to go for a natural vaginal delivery in twin pregnancy. Okay. So, and with respect to these things are respect to monochorionic and monoamniotic and monochorionic and diamniotic. But when it comes to dichorionic and diamniotic pregnancy, the presenting part of the first baby, okay, is what necessary here. If the first baby is presenting towards the vaginal part, means the head is down or cephalic position in the first baby, then obviously you can go for natural vaginal delivery. Okay, and also like the all other conditions should be normal. It should not be polyhydramnios. The mother should not have preeclampsia. Okay, if the gestational diabetes mellitus is under control, then obviously she can go for a cephalic vaginal delivery. And if the baby is cephalic and one baby, the presenting first baby is in cephalic position and the next baby is in breech position. Here comes the gynecologist experience. Okay, so if she or he is confident enough and the thing is fine and they can turn the baby, like the external cephalic version is a method where the second baby can be turned into cephalic, or else they can manage to deliver the second baby through the vagina. Okay, that is where a cephalic or breech can also happen, but the first baby should be always in a cephalic position. Okay, and also in case of dichorionic and diamniotic, if the both the babies are in breech as well, then also it can lead to a C-section. And if the first baby is in breech and second baby is in cephalic, then also it would lead to a C-section. Okay, that is what the mode of delivery. Yeah. So as I told, dichorionic and diamniotic twins, it's best suitable for the vaginal delivery. Diamniotic monochronic, less suitable for normal vaginal delivery. Only mode is through C-section in case of monoamniotic and monochorionic twins. So hope you understood everything with respect to until the delivery of the twin babies. Right? After that, again, you'll get lots of doubts and queries, like once you deliver the babies, both the babies, but then starts another phase of challenges, right? In your motherhood journey starts, and the first thing is postpartum depression, sleep deprivation, financial burdens, social isolation, and postpartum hemorrhage. Okay, most of the moms will struggle with respect to postpartum depression. Okay, like more than 1 in 10 women so experience postpartum depression because like, if it is a first pregnancy, then it's quite impossible and it's quite difficult to manage both the babies with respect to their sleep, with respect to their feeding, all right, and also with respect to the like you would be in your recovery phase as well since at the moment you deliver. Okay, so that is where you experience postpartum depression. And how to overcome this postpartum depression? relying upon meditation. Like if you see, now you've understood what are the things, right? And you'll be able to manage. You would be much confident. One thing is if the lack of knowledge, then also you'll be going into depression. And the next thing is difficult to manage. And if you're not having good amount of family support, and if you also have this other medical complications, then also you will be going into depressions. And also due to the sleep deprivation, right? Because of sleep is very much necessary for a human being. Okay, and everything is interrelated. If you are getting enough amount of sleep, then good amount of oxytocin hormone is also secreting in the body, and that can lead to a better breastfeeding. Right, everything is interconnected over there. So then the depression would also be less. And if you're involving yourself in the yoga and meditation, keep chanting the mantras, keep chanting the hymns of your wish, and you can rely upon God as well. Okay, these things helps in reducing your postpartum depression. Okay, and also sometimes you may get doubt like whether these both the babies would be in a better bonding, or whether I'm like whether you are feeding both the babies well, or whether you are somewhere hurting the babies. You are not feeding one baby and you're not meeting up their expectations, right? These things will comes up, and it's okay. This it is also a new thing for you. Okay, like in from the womb time itself, you keep talking to your babies, right? And you're making them strong, and already the babies are connected with you, and the babies much more strong now, because you both are yourself and your husband, and you both parents are making the baby strong, and you're also keeping strong yourself. Then you can overcome this depression. Yeah, and next the sleep deprivation. So first 3 months after the delivery would be like more of the challenges for you both couples, right? So to take care of both the babies. But if you both are working together, like if you both are much more supportive to each other, so you can just take care. Like if the her wife is sleeping, then husband can take care of the babies. Or else one baby is getting latched well and the other baby is not getting latched. And also if the mother is not able to breastfeed well and the baby is having a difficulty in latching, then the dad can try to feed the babies through the like by pumping the breast milk out of the manually, or by through the electric breast pump. Okay, and they can feed with the feeding bottles as well, okay, for few days. Yeah. And then regarding financial burdens, like when it comes to multiples, and also at a time raising two babies will also be financially also we have to take care, right? So even that could make you going into postpartum depression, and also social isolation. So when you go for any parties, or like soon after delivery, you will try to go into some social engagements, anything like taking care of both the babies, holding them is also like minute, small thing would also become a challenging for you here, right? And also postpartum hemorrhage, as there is vast placenta nurturing both the babies. Once the delivery has happened, then can leads to postpartum hemorrhage. Lots of bleeding can happen. So this is also one among the challenges you experience here. Okay, and the main challenge you face here is a breastfeeding, right? So most of you will be having a doubt like, how can I breastfeed my baby? Like, how should I breastfeed both the babies at a time? Or should I breastfeed one baby first, or then the other baby, right? So breastfeeding is also one among the challenge, or like we should be very much knowledgeable with respect to breastfeeding also post delivery. Okay, so it is the best nutrition, because the baby, like when the babies are in the womb, you are the main source for the baby's nourishment. Similarly, when the babies are delivered and until it's 1.5 to 2 years, you are the main source for nutrition, and like both at least for 6 months, right? Only after 6 months you'll be introducing solid foods to the baby. And until 6 months, mandatorily the babies are relying upon your breast milk. Yes, and it has lots of nutrition values, immunity, if you're breastfeeding your baby. That is why even though if you have lots of difficulties, but still you nourish your baby through the breast milk. You try to take lots of galactic as well, which helps in better production of breast milk, and you nourish your babies. Okay, so if it is a C-section delivery, then how does the breast milk production happens? When there is oxytocin hormone released from hypothalamus, then there will be a sensation for your breast, and then it leads to breast milk production. And once the baby latches, the breast milk will be produced. But in case of C-section, what happens? The oxytocin hormone is not immediately secreted over there, and you can find bit difficulty in breastfeeding the babies for few hours. After that, as natural process, oxytocin hormone will be released, and until then, feeding the babies with formula milk is completely fine. You need not to be worried. Okay, if I give the formula milk to the baby, whether the baby is getting nourished well or whether the baby would not be able to latch my milk further or not, right? So you'll be having lots of doubts with regarding that. But at that moment, when you are helpless, right? So for particular time, if you are feeding with a formula milk, then it's completely fine. Okay, and the main thing is you will be finding difficulty in how to feed the babies with the positions, right? Whether two babies can also breastfeed at a time or not, right? You will be finding lots of difficulties in with respect to positioning of the babies at the time of breastfeeding. Yeah. So there are few multiple, like it's up to you if you are fine and if you are able to now give the baby breastfeed easily with your comfortable position, it's completely fine. And if you like, there are few of the standardized position which you can follow for feeding your babies. One is laid back position. There you can lie on your back and you can just put up both the babies on your tummy and you can nourish or feed the babies. And the next thing is twin football hold. Here you can just sit or some comfortably by leaning back over a position, proper position, and then you can nourish the babies, both of them, by keeping them in each arm horizontally. And then front V hold. So sitting comfortably and you can just lean against one arm and then you can nourish the babies. Okay, and then you can just, yeah, so you can, sorry, you can nourish the babies with the other position as well. And you can just give the babies by both a parallel position. So here you can keep the babies in the parallel side. You can just lie down here, or else you can just try to lean on your back side and you can feed the babies in this position as well. Mainly laid back position, twin football position, front V hold, and parallel position are the standardized positions in breastfeeding. Okay, so like I feel most of the challenges post delivery with respect to twin pregnancy is breastfeeding. So I just included that part. Yeah, so this is how you can manage and you can take care of your twins in your pregnancy period and postpartum period as well.
Thank you, Dr. Janvi. That was really insightful and we learned so much. There are a few questions in the chat box. If you all have any questions, you all can raise your hand and unmute yourself and ask the doctor as well. I'll read the questions in the chat box till then. If I'm working, till what week is it safe to go to office in case of DCDA pregnancy?
Yeah. So in case of dichorionic diamniotic pregnancy, you can go to office based like at which week you are in now. Can you please unmute yourself
Prerna
and tell?
Sood, if you could unmute and ask your question. Are you still here? She's not here, I think.
Same question for me as well. I'm in
Yes,
32nd week.
Yeah. So if there is no other complications with your pregnancy like polyhydramnios or gestational diabetes mellitus or preeclampsia, then you can go to office until 36th week of pregnancy.
Okay, thank you.
Most welcome.
The next question is, why are twins delivered earlier than 40 weeks even without complications?
Yeah. So here what happens, post 36 weeks, the babies will be increasing in its weight. Even though there is no complications, there can be chances of taking their cords around the neck. Okay, it can happen in singleton pregnancy as well, but here both the babies are there in the placenta and there would be pressure over this placenta, and that is why it is always, as a safer side, it is advisable to deliver the babies by 36th week of pregnancy only in case of monochorionic and monoamniotic, and monochorionic and diamniotic. If you have dichorionic and diamniotic, and if you don't have any complication, and as I told, the position of the babies are suitable for normal vaginal delivery, the gynecs would be waiting maximum until 37th week. And after that, by doing internal examination, per vaginal examination, if the things are fine, they'll wait for until natural contractions, or else they'll be going for a induction of labor. Most of the time, they won't wait until you get natural contraction. They will be delivered by 37th week on inducing the labor.
Okay. Shruti's question is taking the lung cover steroid absolutely necessary even if we are going till 36 weeks? I have DCDA pregnancy.
Okay. So mainly in DCDA pregnancy, it is not mandatory, but again, you'll have to see if there is any other complication. So if you're confident enough, and if the gynec is known that there is no other complications, then going for a lung maturation injection at 36 week is not necessary. Until and unless there is no complications associated.
Yeah, so there are no complications. Shruti here, sorry. So there
Yeah.
are no complications, but I think what my gynec is suggesting is that just for safe side. So
Yeah.
I've heard a lot of side effects. You also mentioned that, ADHD, there's a risk of ADHD. So there's a risk involved. So I'm wondering if, there are no complications and
why the gynec has advised you to go for a
Yeah.
injection, lung maturation injection. Yeah.
Yeah.
So just as a safer side, the gynec should be advising you to go for this lung maturation injections. Okay. So like like the baby's lung would be matured only in 36 to 37th week. And what if there is early contractions happens, as I told you, unlike a normal singleton pregnancy, in twin pregnancy, there would be pressure over the uterus and placenta. Obviously, if the two babies and that much weight would be there, no? So there can be chances of placenta previa, okay? Or there can be chances of antepartum hemorrhage, okay? So there can be chances sometimes in 36 or 37th week itself, there can be chances of delivery. So that is why, as a safer side, if the baby is delivered between 36 or 37th week, to keep the babies in considering the babies respiration, they are advising you this steroidal injection. It is completely fine. Okay, you not to be skeptical about this. It's good, and you can go with it.
Okay, thank you.
Praniti's
Hello, ma'am.
question is, Deepika, you can go ahead.
Hello, ma'am. I'm Deepika here.
Yeah.
Actually, I'm 29th week now, and my gynae
Okay.
suggested I have conceived DCDA twins with the IVF. So she told me that it's very rare to go beyond 34 weeks. Like 35 to reach 35, 36 weeks is very rare. So if 34 weeks, we'll do C-section. We don't want to take a chance for normal delivery. So like I wanted to know, and I'm on complete bed rest since like 3.5 months. So like, is it possible to take it to 36 weeks, and is it necessary for C-section? Like I know her concern, like she wants like it to be done on a safer side.
Yeah. So at presently you're in 29th week.
In 29 weeks, 29 running. So it is 28 plus 3 days.
Okay. And as you told, you're under bed rest. So what's the reason for bed rest?
I had a leaking and bleeding in 3.5 months, and it went for and I yeah, due to because my one placenta was down covering it was
placenta
covering the cervix, so bleeding, and there was uterine contractions as well, for which she has medication. So I'm on medication for uterine relaxation for that. So yeah, 4 months there is no bleeding, and sometimes contractions happen, but yeah, I'm on medications for those, but yeah, other than that there is no bleeding after that. And also had a GDM issue. So currently my sugars are controlled, but initially that time when I had also for 2 months my sugars were like slightly increased, not too much. currently, since past 1.5 months, it's under control, and
Okay.
so yeah,
Yeah.
she told me this. So I want to ask you about this.
Okay, see. So as there was a episode of bleeding, so that could be because of the low-lying placenta earlier, and also you're telling you had mild uterine contractions. Keeping all these things in mind, gynec is advising you to go for a early C-section. Okay, and also you have gestational diabetes mellitus that can affect the babies as well. This can lead to increase in amniotic fluid levels. Okay, you can wait with good amount of rest, and they'll be monitoring you, and until 36th week, with if there is no other complications as such, like they also has to see the nourishment. If the babies are getting nourished well, if there is no increase in PI value, and then they can wait and they can extend until 36th week. After that, they would be advising you C-section. Okay, like
Okay, so it
only
is
dichorion.
okay. So, ma'am, after 7 months, once I complete this, so they will be doing my doctor every weekly, and so like if everything is okay in 34 weeks, so can we take like 1 or 2 weeks more, or is it like
Yeah,
is it okay? Is it necessary to go under C-section?
yeah. So again, it depends upon your condition at that particular time here. So
Okay.
gynecologist, you can discuss with your gynecologist. However, you told they'll be doing a Doppler scan, right? So if in the Doppler scan, everything is fine and normal, and they'll be also monitoring you for the uterine contractions. Okay, if they are getting any mild contractions, they'll be observing even that as well. So if everything is fine, and if you're not getting early contractions, then they can wait until your 34 to 36 week. But the baby's nourishment, each and every organ should be completely developed except baby's lung by 34th week. Okay, that is why they are advising you to go for this elective C-section just to
Did
avoid.
right coverage also, na, before 34 weeks, because
Yeah, they would be advising you for lung maturation injections. Again, the steroidal injections would be given. Only the lungs is the one which would be matured after 36th week.
so they will be giving it to me before 34 weeks, right?
Yes,
In my
if they are,
the
yeah.
contract starts, so that's why on the safer side.
Yes, exactly. So to avoid any other complications, however, before the delivery, they would be advising you to go for this steroidal injections. And again, you can wait. And if you feel like if the reports everything is fine, and you can just wait and you can discuss with your gynecologist at that particular time.
Okay, ma'am. So one last question. So in my
Yeah.
case, normal delivery, is there any chance of normal delivery, or like I should be ready for C-section only?
Yeah, so to tell this, I had to go through your reports, because anyone should undergo through your reports. Like vaguely, I can't tell. And if I tell you and I give you confidence, then again you think your gynecologist would be like misleading you. So like you told you had that bleeding, right? So that bleeding, yours is
Yes.
dichorionic diamniotic twin pregnancy,
Yes.
right? DCDA. Oh, okay. And
Yes,
also
ma'am.
the position. See, you're just in your 28th week now. Main thing, the baby's position should be the thing to decide your mode of delivery, right? So now the baby would be in
Oh.
cephalic, but there can be chances that baby can itself change into a breech position. So there are lots of factors to decide the process of natural vaginal delivery, dear. So I can't promise you, or I can't give you a surety whether you can go for it or not. Again, like complete knowledge about your condition is necessary here.
Thank you, ma'am. Thank you so much.
Oh,
Praniti's question is, do you require circlage with twin pregnancy?
yes. So circlage is not mandatory if it is a monochorionic monoamniotic, and if it is a monochorionic monoamniotic, and then if the level of your cervix length is less, then obviously a cervical circlage is necessary, but it's not generally for all the twin pregnancy.
Okay.
Ma'am?
And
Okay.
if you all could
Yeah.
just raise your hand, I will ask you all to unmute and ask the next question. Unless that was Praniti.
No, this is Pooja. I've put the question in the chat box.
Okay. Okay, great. So what week are twins delivered is again Praniti's question.
Okay. So, Pranti, if you have a monochorionic, monoamniotic, and if, as I told, there are complications like twin-to-twin syndrome, if there is any complications as such, then based on the baby's nourishment, okay, if the twin-to-twin syndrome is already there, by 28th week itself, the baby is like seeing the chances or seeing the complications. Based on that, it will be delivered. Or else, if everything is fine with the nourishment and both the babies are getting nourished well, then by 32nd to 36th week, the babies would be delivered in case of monochorionic and monoamniotic, and also monochorionic and diamniotic. But in case of diamniotic, dichorionic, they can wait until for natural contractions if the baby's position is cephalic. Hope you understood, Praniti.
Thank you. Pooja's question is, what would be the best sleeping position in case of twins? I'm in my 30th week. I keep shifting from left to right. For some time, I sleep on my back.
Okay, so for any pregnancy, even though you are a twin pregnancy or a singleton pregnancy, it is advisable during pregnancy post 5th month to sleep on your lateral sides. It can be a left lateral side or it can be right lateral side as well, but mostly we recommend you to sleep on your left lateral side. Why? Because you're not putting or you're not exerting pressure over your aorta. If you are sleeping on back, the baby's weight would be increased post 5 months, and there would be pressure over the aorta, which is carrying blood to the baby. And why we suggest to sleep on your left lateral side? So if you are sleeping on left lateral side, that can leads to better blood circulation and blood flow to the babies. That is why left lateral side is advisable. Please, if you have passed 5th month of pregnancy, try to avoid sleeping on back. Just for relaxing for about 1 to 5 minutes, you can sleep on your back, or else while changing the, see, if you're turning from left lateral side to right lateral side, at that time, just turn from your left lateral side and you can just try to place your hands and legs over the bed and put up a pressure on your buttocks, and then you can just change onto your right lateral side, or else just for 5 minutes, you can sleep on your back. And like if you are below 5 months, then you can sleep on your back, left or right, no problem.
Okay. Is this the reason why my PI has come to 1.38? Like in last in 20 when I was 28 weeks 6 days, I got the scan done, growth scan done. So
Okay.
it mentioned that it shows bilateral notches and the PI
Okay.
0.38.
Okay. So just lying on your back doesn't give your PA values on higher side. There are lots other factors for that. Okay, so just don't worry, you are not caused any harmful for the baby there. Okay, it's just as the uterine artery pressure has been increased. So for how long do you used to sleep on back?
So I think 15-20 minutes. While shifting, I stays 15-20 minutes on the back, and then I shift to the right. Then after that, I'm there for like 30 minutes, 1 hour or something. Then I again come to left.
Okay. So you're not lying on your back for longer hours, right?
No.
Okay, fine. But now you got to know the reasons, right? So from going forward, you just try to avoid sleeping on back for longer hours.
Okay. Then why, like, what can be done for the increased PI? Because it's mentioned in the report that this can be a precursor for PIH or preeclampsia.
So your early scan reports and the NT scan reports and in your NIPT results or double marker test, everything was fine?
Yes.
Under low risk?
Yeah.
Everything was fine. Okay, so what's your age?
I'm 31.
Okay, fine. So just your, there is, like in which scan you got to know that there are notches, in which doc scan?
This is the second growth scan that I got it done in 28 weeks, 6 days.
Okay, fine. So there can be chances of preeclampsia which is not detected earlier. Okay, so it could be because of the blood supply. There would be pressure in the blood supply or placental blood supply to the baby. That is why you are experiencing this notches has been observed. So what you can do here to reduce your PI values is you can just rely upon yoga and meditation, especially there is a pranayama called Shitali pranayama. You can involve in that, and again your gynae could have advised you few of the medications, right? And you can just reach out your care manager as well in detail for a better suggestions.
Okay.
Like she would try Shitali pranayama. You can just reach out to your care manager. Yeah.
Oh, thank you.
Hello,
A
doctor. Hi.
few,
Uh,
I
hi.
can't see your
In-
name.
My name is Siddhi.
Okay,
Oh,
go ahead.
Yeah. Yeah. So I wanted to basically, in the continuation of the right to left, basically, I want to ask, I'm in 31 weeks now,
okay.
DCDA pregnancy. And while turning from left to right or right to left, I have
Hmm.
extreme pain in the, the ligaments, or basically in the
Hmm.
uterus
Yeah.
part or something, like, it pains extremely when I turn from left to right or right to left.
Okay. Okay. Yeah. So aren't you using pregnancy pillow?
Yeah, I am using.
Okay. Even though you are experiencing the pain, right? So one thing
Yeah,
here.
yes.
Oh, okay, okay. So one thing here, because of the body weight, okay, you would have increased your body weight, and sleeping on one particular side would obviously leads to a body pain, right? And there would be pressure over your ligaments and muscles, and that is why you should keep changing the positions. You can sleep on your right lateral side as well for about an hour or 2 hours, and then maximum hours try to sleep on your left lateral side. It's better to keep pillows surrounding you so that you're giving a better cushion kind of support. Okay, and once you feel like it's just kind of a these are the small complications, which is a kind of part and parcel of a pregnancy journey. Okay, so
Okay.
until and unless you deliver, like these complications and these pains would be like it would be continuing. So you can manage this with the pillows, and also once you
Okay.
wake up in the morning, try to do some stretching exercise on your bed itself.
Okay. Thank you. And also one more question I had is that,
Yeah.
especially during the night, like if I
Hmm.
touch my tummy or my belly, and if the babies are moving,
Hmm.
so I feel there's like a lot, maybe it's head or something of the baby, which is like, I find it at a very lower side, like lot below the belly, like the
Hmm.
belly button.
Okay.
So somewhere I had read that, like the baby goes into the head down position.
Hmm.
Maybe they are like getting ready for the labor, or something like that. So
Hmm.
is that some symptom, or like it pains also because it's so down, like, so like very near the uterus or near the panty line only. So
Oh.
it's very hard. So maybe it's the head. So I am not sure what exactly what part it is, but it pains also, like, and
Hmm.
I am not sure, like, it's especially during the night, not during the day.
Okay, okay. So here what happens whenever you're lying down in position, no? So there would be pressure over your uterus ligaments. There is a ligament called round ligament and broad ligament. And also there are surrounding uterine and bladder muscles as well. Okay, and there is two babies. So it's not like unlike a single baby, there would be pressure over your lower part of the body. Okay, and why only in the night time? Because daytime you would be standing and you'd be working. Are you a working woman?
Yeah, I'm working from home, but
Okay, okay, but still
so
you
I
would be
don't travel.
sitting from morning to
Yeah,
evening, right?
correct.
Huh.
Correct,
Yeah, so
correct.
that is what.
Yes.
So if you're taking breaks in between after every 1 hour, just try to walk in and around and try to lie down as well. Because nighttime you're sleeping for longer hours. That is why you're experiencing that pain. Nothing to be worried here. Okay, so just keep a
Okay.
supportive pillow while sleeping so that the pain would be reducing, and try to walk more often in the daytime.
But the baby's head or something, what I feel that part, it's not some sign of some like early labor or something like that, right?
No,
It's not
no.
related
No,
to.
no, no, not like that. So
Okay.
if you're like only the baby, like it's kind of myth also, we can say only after 36 or 38th week itself, the baby would be moving down into pelvis region and getting interlocked there. And that you won't be able to feel like this. That you experience like whenever you pass your bubble, it feels like something is coming, like you're whenever you're peeing, there could be some pressure, right? But the baby would like you have two babies inside the womb. So there will be
Yeah,
movements of
yeah.
the babies. Okay.
Okay.
So that is when we're
Okay.
experiencing that pressure kind of thing. It's quite normal.
Okay. Thank you so much.
Anita's question is how to know if I have identical or non-identical twins.
Yeah. So that is quite, if you're having dichorionic and diamniotic, then obviously it is a fraternal twins or non-identical twins. If you have a monozygotic twins, or if you have a monochorionic monoamniotic, then only you can be able to understand it is a identical twins. And that again, post delivery only you'll be able to understand with that. But as of now, you just understand about the monochorionic or monoamnionitic is your case means, then it can be chances of highly identical twins.
Okay, Praniti's question is, what kind of crib or bassinet is better for twins once they are born?
Okay. So better to like normally, like whatever the cribs you use, like you can try to put a bigger one. You can use the baby, both the babies you can put up in a single cradle, but it's better always to use the babies individually. Okay, whenever you're feeding, you can just try to take them for at least first 3 to 6 months. It's better to take the babies in your bed itself, or else if you want, you can just place them in a individual cribs, wooden cribs, and it's up to you. What are the normal cribs only? There is no particular cribs for twin pregnancy. Wooden cribs is always fine.
Is there any remedy for severe pain in lower left rib cage while sleeping 25 weeks DCDA?
Okay. So again, here you have to understand whether you have acidity or heartburn issues, or else it's just because of the pressure of baby. So it's always advisable to keep a pregnancy pillow while lying down and keep changing your position.
Okay. Akansha's question. Akansha, you can unmute and add to this as well if you have another one. How to check rotations of MCDA twins?
Yeah. So rotations in the sense, can you please brief me?
Akansha?
Yeah, rotations in the sense movement of baby. Like doctor generally advised to notice the baby's position like 10 times in an hour. But in MCDA, actually I'm having MCTA triplets pregnancy, but two of them are fine and one has not grown up. So I want to know like how I would manage the rotations. Currently I'm in 22nd week. I mean, 22 weeks are completed and 23rd is just started. So how to check that?
So it's always advisable to monitor the baby movements after your meal. Okay, so just try to take your meal and thrice in a day you keep monitoring the baby movements in part of about 4 to 5 hours. Okay, after 5 hours, like you have your major meals like breakfast, lunch, and dinner. So after every meal, you just try to lie on your left lateral side and try to feel for the baby movements. At least there should be a 4 movements similarly, like continuously there could be 4 to 5 movements in different parts of your body. Okay, as it is a triplet, and you should feel multiple baby movements. So 4 to 5 movements, just concentrate it well.
Yeah, actually, I only notice on my lower, I mean, below the navel, I only get to know like babies are here because of their heads. But on the upper part, I'm not able to identify whether they are moving or not. So I was really concerned.
Yeah,
And
the thing is, yeah, yours is first, it's kind of early age, okay, 22nd week. So you just start to feel the baby movements here. Okay, you can't able to distinguish or you can't able to distinguish whether the baby is in upper part or lower part because the baby keeps on moving inside the womb.
And one more thing, like today my doctor suggested that we have to go for C-section only. I'm on completely bed rest because of my past history. Like I had 2 miscarriages earlier. So for MCDA, since it's a TA and third one is not growing up, so can it be a normal delivery or I have to go for C-section only?
Yeah, so already it is a NCDA and there are 3 babies. There is a condition maybe here what has happened is selective intrauterine growth retardation has happened. The placental nourishment is not so good. It is unequal distribution of placenta. That is why one baby is not getting nourished well. And triplets, it's most commonly you will have to go for C-section dear. So they can manage only double, like that is twin pregnancy with respect to the position. That in case of triplets, it's completely advisable to go for C-section for a safer set, especially in India.
Okay. And as we discussed earlier, like moving from left to right, I feel more pain during night itself, and even having sleepless nights from 2 to 3 days now. So, is there any, recommendations which I should follow so that I could have lesser pain between the legs during night.
Mm. Okay. Aren't you using a pregnancy pill, dear?
I am using. I generally keep it between my legs, but it's happening like since I have a office, so I'm working from home itself. So sitting for longer hours from 9 to 6, I have to do the work, and
Oh.
in night itself, I can lay down or do something. So that's why I think it's becoming more hectic now.
Okay. Yeah. So you just try to modify some changes in your daily routine. Okay. Just try to take break after every hour, lie down on your left lateral side or right lateral side for a few minutes, and again continue with your work. At least 5 minutes of break is very much necessary. Okay. Don't sit continuously. If you're sitting continuously, what happened? There will be pressure over your lower part of the abdomen and also lower part of the body. That is why there are spinal cord in our body and there are muscles and ligaments. And if you're sitting for longer hours, there would be pressure over this lumbar segment of our spinal cord, and there would be pressure over the nerves which is passing. That is why while sleeping, you would be experiencing that pain usually. And what is your weight?
Currently, it's 72.
Okay, so like you would have been increased in your pregnancy time. The weight is also
Yes.
increased, right? So
Yes.
that is why sleeping on one side means whole. The three babies' pressure is there, and your body's pressure is there to that particular side of the body, and that is why you're experiencing the pain. You can manage with pregnancy pill on daytime. Make sure you're not sitting continuously.
Okay. And since I said like 2 babies are fine and one didn't grow at the initial stage itself, so it will not cause any harm to other babies, right? It will be safe.
Yeah, so that is why they're advising you to like what has happened here, like I didn't get to completely. So is the third baby is growing still
No,
or
no, the
okay.
third baby didn't grow initially itself. There was no heartbeat in the third baby.
Okay. So they would have mentioned if it is a twin-to-twin transfusion, like as I told you, there is twin-to-twin transfusion, or else TAPS, that is polycythemia, or else if it is a twin arterial pressure, okay, then maybe it could be chances of arterial pressure, and then that is why the third baby's growth and development has stopped, okay, and the surviving babies, there can be chances of mainly kind of brain spraining, okay, or they won't be able to brain activities would be less, okay, they won't be able to do calculations fastly, like that some kind of brain activities would be hampered. That is why gynecologists will have to monitor them closely. Okay, you would have advice once in 2 weeks you will have to visit them and you'll be given extra care.
Oh, yes.
Yeah, so that is why like it's not mandatory that both the babies should be getting affected. And again, it depends upon the condition. If there is anything like that, they would be delivering the babies at the early time itself.
Okay.
Yeah.
Okay,
So just
thank
don't
you.
worry. However, your gynecologist should be monitoring you. Just need not to be panic.
Yeah, sure. Thank you.
I'll take Radhika's question. You can unmute yourself as well, Radhika. In 19th week, I have got my cervical circlage done. My cervix length was 3.2 centimeter. Right now, I'm doing everything with a lot of care. Can I do anything else?
Yeah. So it's fine. However, you have cervical circlage, but still be careful while traveling and while climbing up and down the stairs. Now just rest yourself. You can do household works and more often don't climb up and down the stairs and do go for trekking on off-road traveling. That is what you can follow now. That's it.
Okay, so
Okay,
3.2
Radhika.
was not a minimum thing, right?
Yes, so 3.2 is a normal cervix length. Just as a precautionary measure, your
Precaution, yeah.
gynecologist has advised you to go for cervical circlage.
Right. And there is no way to understand that the DCDA twins which I have are monozygotic or dizygotic, right?
Yeah, so that will not be able to understand whether like the gynecologist can understand that. And for what reason you wanted to know this?
Frankly, just to understand whether it is a same gender baby or opposite gender. That's it.
Yes, that you won't be able to understand now. Post delivery itself, keep waiting. Okay,
Acha,
it can be
okay.
identified.
But there's no
Yeah.
no, and
No, you
also
have DCDA.
yes.
You have DCDA, then obviously it would be non-identical twins, and it would be obviously it can be like it can be a different gender or it can be a same gender as well. Okay, that we
No,
can disclose.
no, that's what the question was. If it is a monozygotic and that got split into two, so
Yeah.
I mean, I have learned a little of bio. So if one sperm is doing that, then it has to be a same gender, no? Or no?
Yes, in respect to monozygotic.
Yeah, monozygotic, right.
Yeah. So in respect to dizygotic and I mean like dizygotic twins also, there can be chances like both the sperm can share the same chromosome.
Correct.
So there
Right.
they can have a same gender or it can have
Okay.
a different gender as well.
Right. Okay. So there are very less chances of they look alike. So it's like two different pregnancies happening at a time, no?
Yes. Now in dizygotic, diamniotic, like morally they will be like alike,
Acha.
not identical or fraternal.
Okay. And also the placenta position, I mean, one of my placenta is anterior, the other one is left lap. So what I think is the anterior one, the movements are not really, I mean,
Yeah.
not very rigorous, but the
Yes.
other one, like he or she is doing very fine. So because of the placenta, no? If it is
Yes.
anterior, we may feel it a little lesser.
Yes, exactly. If the placenta is anterior, there are lots of muscles below our abdomen, and there is uterus, and below that there are lots of layers of tissues and muscles, right? And also next comes the placenta, and this
Acha.
placenta is covering the fetus. That is why you're feeling less baby movements of one side, and then the other side is you're having better baby movements. In case of anterior placenta, you feel lesser baby movements.
Okay. And also, I have heard a myth that in the twins' pregnancy, once they get delivered, it will happen everything at a time, maybe. Like they'll cry at a time, they'll do everything at a time. So,
Yeah, that doesn't happen in your condition because it is a dizygotic twins and also diamniotic diachronic twins. Only this can happen mainly in monochorionic and monoamniotic twins. Okay, because they share same placenta, they share same amniotic fluid, and they have that bonding. Okay, that
correct.
can happen only in CME.
Correct. So, not in my case.
No, not at all.
All right. Okay. Thank you so much.
Okay,
Uh,
Radhika.
Last two questions we'll take for Siddhi and Tejal. Siddhi's question is, hey ma'am, I'm in 23rd week with DCDA twins. Doctor prescribed me Duadilin medicine. So will it help me to have full-term baby? Siddhi,
Yeah.
like to add anything? Okay. Dr. Janvi, you can take over.
Oh, okay. So Duodelin is a progesterone hormone injection. It is given for the maintenance of pregnancy and for the better growth of the babies inside the uterus. Okay, so with this, we can't determine that you can go for normal vaginal delivery, like, or you can complete your full term. So this has been advised to maintain your pregnancy itself, and you can, like, if there is no other complications, obviously you can complete a full term.
Okay. And Tejal's question. Tejal, would you like to unmute and ask?
Yeah, hello, doctor.
Yeah, hi, Tejal.
Yeah, so actually, I'm right now in my third month. It's IVF pregnancy. It's a DCDA, and my BMI is a 28. It's almost a 28. I haven't gained a weight yet, but the doctor has told me that I might have a diabetes and might have some issues like further in a pregnancy. So I just want to be precautious कि what should I from like right now कि मुझे क्या क्या करना चाहिए which will help me to avoid these complications.
Yeah. So gestational diabetes mellitus can happen in IVF pregnancy and also in respect to the age and also with respect to twin pregnancy. Okay, it is a kind of maternal complications as I explained earlier. So just try to follow your diet as given by your nutritionist and try to follow proper yoga, that is Sukshma yoga you can follow. Okay, and just take, like, your weight is not increasing, that's not a concern, it's fine if the babies are getting nourished well and if the babies are gaining a proper weight. Okay, so just don't worry about your weight gain, and however you'll be going for a test called oral glucose tolerance test in your next few weeks between 24th to 26th week, and in that test you'll be able to understand whether you have gestational diabetes mellitus or not. Okay.
Okay, so actually, September, like end of a September, I'm having a first NT scan, which is a.
Okay, which week are you in presently?
I'm at a 10th week.
Oh, okay, okay. I heard like you're in 23rd week. Sorry.
Yeah.
So just in 10th week, right? So yeah, you can get your NT scan done. So as of now, just don't worry about the precautionary measures. You just try to, because you're in the early phase of your pregnancy. Do you have nausea and vomiting?
No.
Oh, okay, great. Okay, great. So just at this period of time, just do avoid intake of too much of sugar and maintain the bed rest. Okay, just rely upon yoga and going forward, like you still have NT scan to be done. And if there is any complications associated in NT scan, then only according to your situation, the care and support has to be given. Now you don't have any complications, so just practice all the good things, follow a proper Garbha Sanskara. That's enough, that's it.
Okay, okay, doctor. Thank you.
And the last question, Chandana's question, what are the signs of labor in case of twin pregnancy?
Yeah, similarly, if your pregnancy has been DCDA and if you are going beyond 37th week, you would be getting contractions, you'll be getting pain from your lower back to, like, it can radiate, or else there can be chances of amniotic fluid sac broken, and also there can be chances of the contractions. Okay, pain like period cramps, contractions, and also the fluid break. Like similarly, if you are going until 37 week and if you're completing full term, then similar to normal vaginal delivery itself, you'll be getting the symptoms and signs.
Okay, and Chandana's next question is, I'm in my 29th week and most of the time I'm sleeping on my back without my knowledge because of severe upper back pain on both sides. Is there any solution for that?
Okay, so better you just check with your mattress first. Okay, the small things we can, if you just check, it would be fine. So, and you try to lie on a hard wooden plank. Upon that, you use your mattress and you just try to keep a pregnancy pillow. And for upper body pain, you can just try to use a warm coconut oil for a massage. No need of massage. So you can just apply the oil over your upper part of the body, and you can take hot water backpack, or else you can try to take hot water bath every day. Okay, and also like morning, like in the daytime, whenever you're sitting, always you should sit in a erect position like this. You should not hunch back your back. Even that could leads to the upper back pain. Okay, so then you try to sleep on your lateral side. So going forward, please don't sleep on back.
Okay, ma'am. Thank you.
Thank you so much, Dr. Janvi. That was really insightful. Thank you for all the patience you had to answer so many questions. I know the session was delayed and extended a lot. Thank you, mommy, for staying till here and listening to all the questions and asking such amazing questions. I'm sure everybody else got to learn a lot. And yeah, once again, thank you, Dr. Janvi, for all the efforts you took for us. We really appreciate it. And
Yeah.
please do take a few minutes to share your feedback in the chat and in the community group. I'll be sharing the feedback form, Momi. So please do share that.
It was a
Okay,
great
yeah.
session.
Yes,
Thank you,
sure.
ma'am.
Yeah, thank you so much. Also, after some weeks, please let us know if you can connect again.
Definitely. Whoever wants to get in touch with Dr. Janvi, please, you can DM me and I'll help you do the same. Okay?
Yeah, sure. Thank you.
Thank you, everybody. Have a great evening. Thank you, Dr. Janvi.
Yeah, thank you, Kiran. Most welcome. Yeah. Thank you so much for all the moments who listen in patience. Thank you so much. Nice to meet you all.
Bye. Good night.